Now, in our third year of the pandemic, Canadians are dealing with an even more infectious COVID-19 variant, the BA2 subvariant of Omicron. Health officials are saying a recent resurgence of COVID-19 patients in hospitals across Canada will likely continue for another month. Quebec, Ontario, Nova Scotia, and the Prairies have all reported an increase in hospitalizations from the virus. However, infections in the general population can differ from person to person. Some may experience severe symptoms, while others compare their cases to the common cold, and some may not have symptoms at all. So, what do we know so far about how COVID interacts with the body and why symptoms differ between people? Well, joining us now to give us some clarity on this in our weekly medical segment is Dr. Abhishek Raut, Medical Director at Appletree Medical Group. Dr. Raut, welcome back to Forum Daily.
Great to be here.
Now, as we mentioned, some infections can cause severe symptoms, while others might not feel any symptoms at all with COVID. So why do COVID infections differ so much between people?
That's a great question. I mean, we're talking about 2 years of COVID-19 now, millions of cases, and still we have the question of why do some people get infected, others don't necessarily get infected or have very minimal symptoms. Now, there's a lot of factors at play here which determine how a person gets sick and whether they get sick, what symptoms they have, and what they can transmit. Researchers don't really know all the answers yet, but I think there is a number of reasons here that why some people are intrinsically resistant to COVID-19. I think there's likely some genetic factors at play here that cause this intrinsic immunity. Now, this concept isn't new to COVID-19. It's believed that a small percentage of people have always been immune to things such as the plague, even hundreds of years ago. And some people are actually immune to HIV, even if exposed. But what we're talking about is a very small percentage of the population here. And many others, in fact, are infected and do experience very slight symptoms and are basically asymptomatic.
So what do we know about this small percentage of the population that may not experience these severe symptoms compared to others who may experience a more of a severe case?
That's right. So first, a person has to be infected, meaning they are exposed to the virus and it's gotten into that cells. After that, a person could be asymptomatic, have mild symptoms, or even develop more severe or life-threatening disease. What we do know is that when a virus comes into our body, especially COVID-19, it attaches to a range of proteins on our cells. These protein connections then really start the pathway towards making us unfortunately sick. But the theory is that many different people have different protein variants, and some of them make them less appealing to viruses. So we have these differences in our genes. Some differences, they're not a big deal, at least we don't think they're a big deal under most common scenarios. And then there are some genes that can be quite dangerous as well. These genetic variances could likely explain a part of the puzzle on the differences in reaction with COVID-19. There's, of course, a lot of other factors that play a role as well.
And in terms of these other factors, we hear a lot about how stress can affect the body. So are there any environmental factors such as stress or maybe a lack of healthy eating that might impact how the virus affects the body?
Absolutely. I would answer that with all of the above. I think the most important feature beyond the virus itself is the person's immunity or immune status. We know that elderly people have a less robust immune system compared to young adults and children. And even though a child's immune system is not as educated compared to adults, the immune response it leans more toward what is referred to as that innate immunity, because it's already primed and activated in certain facets and can adjust rapidly. Other than that, what we do know is because children have smaller airways, this could also explain why some are being hospitalized for COVID-19, since Omicron tends to favor the upper respiratory tract rather than the lungs.
All right, Dr. Raut. Well, other than regular masking, sanitizing, and social distancing, what other steps can people take to improve their overall health in order to fight off this virus?
Well, so age and pre-existing medical conditions are likely the highest risk factors when it comes to developing severe disease from COVID-19. Older adults, especially those over 60, make up a greater share of COVID-19 hospitalizations and deaths than younger groups. The Public Health Agency of Canada has reported that more than half of all reported cases of COVID-19 have involved those under 60, but individuals older than that make up nearly 2/3 of all hospitalizations. So a number of chronic medical conditions, such as lung and heart disease, hypertension, high blood pressure, diabetes, kidney and liver disease, all can worsen outcomes. So the ideal thing to do here is work on optimizing those medical conditions when we can, making sure the blood pressure is down, making sure the sugars are in control, which can then prevent and fight off this virus.
All right, Dr. Raut, always an informative interview. Thank you again for joining us today.
Thanks so much for having me.